ni TV47 Breakfast Show ukiwa nami Corazon Sofan pamoja na mwenzangu Emmanuel Terer. Kwa sasa mtazamaji, na kupeleka moja kwa moja katika mazungumzo ambayo niliweza kuwa nayo na daktari mmoja ambaye ni daktari wa masuala ya njia ya uzazi na pia ni surgeon ama mpasuaji, na pia anashughulikia matibabu ya saratani, na tukaweza kuzungumza kuhusu ukaguzi wa saratani ambao sasa umekuwa ni ugonjwa sugu na ugonjwa ambao umeleta hofu sana katika jamii yetu. Tazama. Okay.
So,
This goes here.
this one is here.
Essentially I should be naked, eh?
Yeah, you
Nafaa
should be
kwa
naked.
nimetoa zote.
Everything.
Okay.
And then we strap this behind.
It's actually a beautiful gown. Wale watu ambao wanaogopa kuja angalau waje tu wakavalishwe the royal color. The purple. Okay, so it's all tied up like that. So it is fully closed. And then do I get
And
out?
then after the gowning, now you have to come
Okay.
on top of the cover.
All right, and that means I come like this, and that's it, and then I have to lie down.
You now have to lay on the back,
Okay,
like this side.
and
And then after laying on the back,
okay,
we'll strap the legs up.
okay. So the legs are supposed to go on this. So inaingizwa ndani like this. If I was to,
If you have to lie, take this one here. Then we usually support it from
from here, okay. Just do that. We see what it looks like.
Yeah,
Okay, and then this side.
that one. But the whole purpose is
It's so that
these
it
legs
can
are
be
actually
open.
here.
Ah,
and there.
on this end and on this end.
And outside here
No.
and outside there.
Okay,
Yeah.
so this is for strapping the legs to give that freedom.
To support the legs.
Okay, and then essentially you lie down,
Yes.
the legs up.
or then the legs go up and the curtains go closing.
Yes.
Okay, so the doctor will come.
Can you close? Yeah, and generally we have, we always do with a chaperone, with a nurse. We never do the procedures alone. We, especially when it's a male gynecologist, a male doctor, male clinician, we actually have a nurse around to assist so that the procedure we do is clean, we don't contaminate stuff. But at the same time, it's good practice, medical practice, to have somebody else standing by.
Standing by the
Also,
doctor.
yeah, to ensure also that the right things are done.
Okay, I can see you have quite an equipment. What am I looking at with this?
Yeah. For this one, it's basically the light.
Okay.
It's basically the light. Once, maybe I explain how the procedure is done and how the light comes in.
Yes, yes.
Allow me to pull this out,
Okay.
just for explanation. Yeah, this stuff here. So generally, the doctor will glove. We never do these procedures without gloving. So we do the gloving as I'm doing here, and then we have already positioned
The patient.
the patient.
Okay.
Yeah. And the next thing is we would have explained to the patient what exactly we're going to do even
Okay.
before you come
All right.
on the couch. And would have explained to the patient exactly what we're going to do.
We still have time, we can start.
Yeah. So, I will have this opened by the nurse to keep it sterile.
Okay.
So I need to put this one there. And then we put a lubricant, the KY jelly, to lubricate it, or even water or saline, depending on what is available in that particular clinic. And then if you could focus here.
Labda mpiga picha alete karibu tu sana. Hii ni mfano wa sehemu ya kike. Ni mfano wake. Is it a dummy of
It's a
the
dummy of
reproductive
the reproductive system.
Okay.
So from here is really from the outside, and then this is the birth canal. It's really the birth canal, and here is the cervix, This is the cervix. Of course, it's cut, yeah, to show us inside, especially if there's a pregnancy. This is where generally you'd have a pregnancy. And this is the uterus, and on the side we generally have the ovaries. So we are talking about the cervix, and the cervix will generally be here. It's really the entrance to the womb. Mlango wa kuingilia kwa nyungu ya mtoto. So because we want to access the cervix, this is the instrument which we use. We call it a speculum. So we'll insert inside and open so that from outside we are able to see the cervix clearly.
Daktari, huu ni wakati ambao unafanya ukaguzi katika sehemu ya uzazi. Kwamba sasa huu ukiwa ni mfano, hapa ndipo tumbo ambapo mtoto analalia na hii ndio njia ya uzazi. Kwa hivyo kifaa hiki kinaingizwa baada ya kuweka maji ya kuyeyusha. Iwe sasa ni rahisi kuingiza ndani kisha unafungua. Unajua kwamba hapo ndio sasa mtu anafikiria kwamba kuna uchungu wakati ambapo kifaa kimeingizwa kisha labda kifunguliwe. Kuna uchungu?
If somebody is well relaxed, as you can see, it's not a big instrument, it's quite standard, and it's not the whole instrument which goes in. After lubricating, it's only this small bit, this bit, which goes in, so that we are able to see the cervix. The rest is really to assist us, and they remain outside to help us to visualize. Now, for this, it's quite comfortable, really. That's what women do say. As compared to previously when we used to have metallic such instruments, which used to be, usually they used to say it's very, very cold. And because it's metallic, it's more uncomfortable. But for the plastic, it tends to be a little bit more comfort. It's actually more comfortable.
More comfort. So kitambo kulikuwa na chuma. Chuma ikiwa na baridi na ule ugumu wote. Hii inaonekana kwamba ni rahisi kidogo. Baada ya kufungua sasa mnatumia haya.
Yeah, so once we insert inside, that's now where the light comes in. We generally we haven't connected, but it's okay.
Tulichukua kifaa chako kimemesha moto. We took your charger so we can't do the lighting. But this is the lighting.
This is the light which now we focus. We focus so that we're able to see the cervix where it is. And at that particular time, as a doctor, you would look around and see how the cervix is. Is there any sign of infection or any growth and the like. And then at that particular time is when now we use this kit. This kit is called Pap Smear kit. So I'm just opening it up. So we have a brush here. Allow me to open it up.
Chris, nipe kwa ukaribu ndo basi mtazamaji aweze kuwa na taswira kamili. Watu wasije wakadhani kwamba ni vifaa vilivyotengenezewa wanyama. Naam. Sasa huu ni wakati ambapo unafanya ukaguzi kule ndani na unataka kufanya pap smear. Pap smear essentially means taking a swab.
A swab, yeah. Okay. Or taking cells from the cervix, and that's by using this brush. So this one goes in to where the cervix is. And as I said, the cervix is here. So this is, sorry. So this is what we are doing. It goes there. Yeah.
So you swipe, unachukua yale ambayo yako hapo.
Ndio.
Naam.
So you rotate it 360 degrees to get those cells out, because they're just there. You don't need to bite them. They're just coming out. And then after that, you come out with a brush, and then there is what we call a glass slide. As you can see, there's a glass slide here, and then we smear on it. We smear on it. By so doing, we are actually leaving those cells which we have removed from the cervix. We are putting them here. And after that, we take, there's some sachet here which has some fluid, which we are calling a fixative. We would generally open it up like that. There's fluid here. The cells are already on the glass slide, and
we
pour on top like that.
Ni maji kabisa haswa. Na slide mtazamaji, basi kama unajua slide ni kama yale ambayo tulitumia katika somo la chemistry, inamaanisha kwamba ukishaweka basi zile cells ambazo umetoka katika sehemu ya uzazi, basi unatilia haya maji ambayo ni kemikali. Na hii kemikali basi itatuonyesha kwamba ni kipi ambacho kipo kwenye sehemu ile, daktari.
Yeah.
All right.
Now,
so does it change color?
It doesn't have to change or do anything. Actually, what we are doing here is to demonstrate how we take the Pap Smear. After we do that, then this is what we're going to send to the lab. Remember, we have just taken the cells, we have fixed them here. The next stage is to send them to the lab for them to be processed and for the pathologists to have a look at these same cells under the microscope.
What was the purpose of the liquid?
The liquid is to, you see, once we have put the cells there, they tend to dry up. And that drying up changes how the cells appear. So to preserve how they appear, we put this fluid, which is to fix these cells and preserve them the way they look, so that we can have a proper interpretation.
Ukazuguzi uwe salama kabisa. Tukimalizia katika hii sehemu daktari, naona kifaa tena nyuma yako. Sijui kifaa kile kingine ni kwa mujibu gani?
Oh yeah. This is an instrument. It's an instrument. As you can see, it can move many directions. Now, it's a microscope. It's basically a microscope. Now, after the Pap Smear comes out, and it shows that the cervix is developing a problem, which can lead to cervical cancer, then that patient needs to be investigated further to determine if it is almost becoming cancerous or whether it's cancer itself. So that is why we have this instrument here. So the patient still comes back, and we do the same thing we are doing, but but this time we don't do a Pap Smear. We put some other chemicals or reagents on the cervix, and then we are able to magnify the cells on the cervix, and then this usually would tell us the abnormal areas on the cervix, and those abnormal areas is where we take a biopsy. Biopsy basically means we take a pinch of very tiny tissue. Now that one will be again processed in the lab and will tell us whether we are dealing with precancer or stages before cancer of the cervix, or whether it has become cancerous.
Daktari, jambo ambalo nimejifunza hapa katika kisehemu hiki ni kwamba si mambo ambayo ni nje ya dunia, ni mambo ambayo yanawezekana na ni mambo ambayo yanaweza kufanyika kwa wepesi mtu anapofika kwa daktari. Ni ukaguzi tu, kufungua mahali pale na kuweza kuchukua kisehemu cha yale ambayo yako pale kisha yakaguliwe. Kwa hivyo hamna haja ya kuwa na hofu wala kudhani kwamba kutakuwa na uchungu. Naam, mtazamaji, kimekuwa ni kisehemu hiki, lakini nitakupeleka kwa dakika 2 tu katika sehemu kingine ama kisehemu kingine humu ndani ambacho kina vifaa vya aina mbalimbali vya chuma. Daktari aweze kutuelezea vifaa vile ambao vinamshtua Pablo katika chumba hiki ni vifaa vya aina gani. Usibanduke. Ni TV47 Breakfast Show, mazungumzo na daktari.